So we've all had to learn some new terms, and certainly one that is unfortunately common at the minute is cocooning, where people are essentially in complete isolation in their home, and it's much more isolating. And often people can become very distant then from neighbours and friends and so on. Thankfully, a lot of supports are being provided now. So volunteers, neighbours, family members may be giving food and so on. Are there any warning signs that they might be able to keep an eye out for as they're maybe bringing meals to loved ones or to people in their community, that could maybe prompt a thought as to whether somebody might need to contact a GP or some other healthcare professional?
Yeah, I suppose it's something that is something that's on my mind a lot as a practitioner, in the sense that I'm blown away on a community level by the offers of support that my patients are telling me they're getting from their neighbours and from people in their community, the offer of meals, of shopping. And really we have a lot to be proud of in this country from a community perspective. But I suppose it's very important to remember that people going through cancer treatment are already very vulnerable. And so when we're providing them with food, or we're providing them with essentials, it's important to check on things like, for example, targeting questions around, how did you get on with the dinner yesterday? Did you eat it all, or was it something that you liked, or did you manage half of the meal? Being, I suppose, a little bit alert to maybe infrequent requests for food. So, we can often put out the message, oh, just contact me when you need to go shopping. But if that request doesn't come, is that person getting the food that they need to stay healthy? Buying perishable foods, or foods that are not perishable, such as canned food and food that will do well in the freezer, is important, so that there's easy access for people. And also checking in that brief contact that you may have with someone, looking for signs that they are healthy and well. So we'd be very concerned about people if we see obvious signs of weight loss, fatigue, if they're pale in colour, and if they're reporting that they're simply not hungry. They will be signs to alert us that there's maybe a problem with malnutrition.
So if somebody saw that in a loved one or someone that they're helping care, they might maybe contact the local public health nurse, or maybe a GP or something, and try and follow up, as well as perhaps with the person themselves who may not notice these changes in their bodies. Would that be the case?
Yeah, I think the first thing is always to try and have that conversation with the person themselves, obviously, maybe over the phone later in the day. Maybe it's a case of, I noticed you weren't your normal self. How are you getting on? And having those conversations and urging the person to contact their team or contact their GP if they're feeling unwell. And also just that repeated check-in over, how are you finding the food that I'm bringing you? Do you like it? Does it suit you? How are you getting on maybe with the nourishing drinks? Just those simple questions can go a long way to helping someone see if they're struggling with their diet.